Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Erica Moore studies lupus using a unique biomaterial that she developed. Erica Moore, Ph.D. Long before she took the helm of her engineering lab as an assistant professor of materials science and engineering at the University of Florida, Erica Moore was fascinated by the careful dance between immune cells and biomaterials engineered to interact with living systems. Now, her curiosity has led her to design biomaterials to help diverse lupus patients receive personalized care. How did you first realize that biomaterials could be useful for studying the immune system? While doing my undergraduate degree at Johns Hopkins University, I started to realize that immune cells are probably going to be an important part of how our bodies respond to biomaterials. My area of expertise is at the meeting point of immunology, biomaterials science, and translational medicine. I was classically trained as a biomedical engineer, so the combination of engineering and medicine is just ingrained into me. Then I was drawn to creating new materials and using those materials to study immunology, but I am not a classically trained immunologist. During my PhD studies at Duke University, I focused on macrophages and understanding their contribution to biomaterials. How did you connect this to studying autoimmunity and lupus specifically? My personal connection to systemic lupus erythematosus, SLE, the autoimmune disease that I study, is that I identify as a woman of color, as a Black woman. I actually have many friends with lupus. There are women in my life who have died from lupus, and I never realized how much of a health inequity and health disparity it was. When I realized that there was this autoimmune disease that disproportionately affects communities that I identify with, I wanted to use my privilege and education to try to improve outcomes for that disease. If we want to study something in the clinic, we have to enroll patients. But that takes a lot of time, effort, and energy. So, during graduate school, I wanted to create a tissue model outside the body that would recreate or mimic some of the interactions that occur in the body. The 3D model system that I created then is a little bit squishy, like Jell-O, mimicking some soft tissues in the body. You can take images of it, destroy it, and create it again. I used this system in graduate school to understand how macrophages help us build new tissues and blood vessels. If we introduce other variables, we can study tissue responses in specific human contexts. For example, women with lupus usually have super-inflammatory immune cells, including a lot of macrophage activation. If we take immune cells from healthy controls or patients with lupus and study them in our biomaterial models, what differences do we observe in those cells? Maybe in the future, we can take some patient cells, put them in our system, and then introduce a drug to see how they respond. Does it get better? Does it get worse? That's better than just putting volunteers on a drug without any prior knowledge or background. How do you consider the variation in lupus between populations? I want to understand the contribution of ancestry to disease pathology and disease progression. We use markers of genetic ancestry to understand how different patients respond. We can declare those variables and use them to determine which groups we encapsulate into our Jell-O biomaterial tissue models, and then understand how their cells respond differently. For example, does the number of discrimination events you have seen inform how your cells respond? What are the challenges for this kind of interdisciplinary work? The hardest part so far has been knowledge. I am personally driven to study this autoimmune disease because of its disproportionate impact, so I really want to learn, and I am still learning. You have to prioritize. I know a lot of people with lupus, and I ask, what's helpful? What's not working? It's a shared community effort. I am really sharing the voices of many people, not just myself. This interview has been edited and condensed for clarity. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.